to the podcast. Today I have my father, Dr. Thomas Cummings, here to recall the events of 9/11 from his perspective, miles away from the attacks. Where were you when you first heard about the attack?
On the morning of September 11th, 2001, I was in medical school in Newark, New Jersey.
How soon after the plane hit the first tower did you hear about it?
I was a third-year medical student, and I was on a trauma surgery rotation. That morning, we were in our morning rounds, our morning meeting with the trauma surgery team, and a nurse came in to the room we were in and said, "Did you hear that a helicopter hit the World Trade Center?"
What about the second plane?
After the nurse said, "Did you hear a helicopter hit the World Trade Center?" The lead trauma surgeon, the attending, said, let's go look. And we had a secure access to the roof of the hospital where the helipad is, where this hospital for my medical school was a level 1 trauma center, and saw some serious trauma. And there was a helipad on the roof, and we took a secure staircase to the roof. And Newark, New Jersey is a pretty clear line right to Lower Manhattan, and it was as I'm sure you know, an especially clear, nice morning that morning. So we went up, and at that point we could just see a little bit of smoke coming from one of the towers. I guess that would have been the North Tower. And we stayed up there for about 5 minutes or so. Then we went back downstairs to start the morning. Again, we didn't have access to TV reports. This is before smartphones or anything. And in the course of the next several minutes, being back down in the hospital, people began mentioning it was much more serious than that. At that point, we went back up to the roof of the hospital, and it was clear that there was a fire in both towers and significant smoke. And with the direct line of sight, it was quite impressive. You could see the smoke billowing up and then down south of Manhattan Island, a very stark picture and very serious. One of my good friends to this day, was on that rotation with me. He ended up going into the Air Force for anesthesiology. I remember standing next to him on the roof as medical students, and he pointed out the fighter jets to me, and he said, "Tom, those fighter jets would have left Cape Cod about 20 minutes ago or so. So they already knew something much more serious was going on." And then it became clear that with both towers hit, these things were much larger than helicopters. And then we got back down to the hospital and got the TVs and started to get the actual reports of what had happened.
Thank you. Were you afraid for your own safety or for anyone close to you?
It was very unnerving. We were very close to New York. Working on the trauma team. That was, again, like I said, a level 1 trauma center, so actually it was a protocol to follow. After the attacks that morning, the Manhattan being an island, there were stations set up, so in the event of emergencies like this, although this would have been difficult to predict, there were plans to get people off of Manhattan to get them better help in case something like this happened or something to this level of severity. So our hospital actually went into a mode to prepare for potential victims of the attack. So I remember helping set up with the trauma team for that in the hospital. And then they started to deploy some of the head trauma surgeons and neurosurgeons, and they set up little bases in Jersey City, New Jersey, right along the water, along the Hudson River, right across from Lower Manhattan. And the plan would be to get victims over to safety and then be able to treat them there and triage them. Of course, in the midst of this, I had a family in this area and other parts of the country that were being affected. So yes, trying to reach people, making sure they were okay. I remember some phone lines were down, hard to get through at times. But yeah, in the course of those several hours, trying to make sure everyone I knew was okay, which they were the ones that I could reach, and then staying to help at the hospital and the team that I was on. I'm originally from that area, so I'm from northern New Jersey, so, very unnerving and a very sort of vulnerable feeling. You grow up with the World Trade Center and the Twin Towers. They're part of your view, they're part of your consciousness, they're always there. You can see them from many parts of the wider New York City metropolitan area. They're very tall, much taller than the Empire State Building, so to see them hurt like that, and the skyline with so much smoke coming was a sight that I won't forget.
Thank you. What effect did 9/11 have on your life after the attacks?
Well, I think I spoke to it a little. I think it left me with a more vulnerable feeling. I think being from the New York area and being American, I think many of us grow up feeling quite secure that we're harder to reach both geographically and with the strength of our military and intelligence, and so I remember a very vulnerable feeling. And New York is such an iconic city and such a major city in the U.S. and in the world. It felt like a real blow to have that happen.
When did you first hear that it was terrorists who carried out the attacks?
I don't remember. It was obviously nonstop news at the time. I don't remember. I was watching it. I know they were giving a lot of advice, to, if you're having a difficult time, not to watch it over and over because it was coming on the news 24 hours a day. But I seemed to be okay with that. And again, I didn't live too far away, so whether I could see the site on the news, I could see it in the air. The air color changed, and there was a smell in the air. So it felt very visceral, very real, whether I was watching on the news or not. But I don't exactly remember when reports of the terrorist plot and the exact details came out that were reliable. But I was watching a lot of news for a few days.
Okay, thank you. What do you remember about the day after September 12th?
September 12th, I was back at the hospital on my rotation. I remember we had set up that sort of trauma staging area, and the hospital was equipped to receive victims. Of course, unfortunately, no one came from the site. Over the next several days, a few firefighters were brought in who I believe were injured during the search and rescue at the site, and they were brought in for help. So being there to help them, and just a strange eeriness in the air. Still, the site was very close, and it felt very real and fresh. Certainly there was, which I'm sure you studied in your class, there certainly was a feeling of bonding and kindness, which unfortunately is too rare in our country amongst people. So you weren't getting upset at the small things and being in traffic and things like that. People felt pretty connected, especially in that being from that northern New Jersey area. Felt it was very much our home.
Yeah. I know you have a story from that day. Someone else's story. Can you please share that?
Sure. So when you first asked me, so really my story of September 11th began on September 10th, 2001. Again, I was on this trauma surgery team. You would work in shifts when you would take call and get alerted to the main traumas in the hospital. Then you'd be there at other times checking on patients in the hospital. So my team was on for that call on Monday, September 10th, 2001. I remember the weather also being very nice that day. We had a routine call. A woman was brought in, severely injured. She was in a very severe motor vehicle accident on the Garden State Parkway, which is a major highway in New Jersey in that area, and we're the closest trauma center to where her accident occurred. That was common for us to get. So she was brought in. We did the trauma protocol. You assess them for injuries. She had severe musculoskeletal injuries and checked their medical status. Her medical status was not well. So I was the main medical student on the team, and I was with an attending trauma surgeon and a resident training doctor trauma surgeon. So the three of us were staying close by her side, and she wasn't doing well medically. She wasn't stable. It's also not uncommon for car accidents for multiple victims to come in at the same time. We were with her, and I remember she was getting a CAT scan because her blood pressure was low, and it seemed like she could be having some bleeding internally. And I remember being in the CAT scan room with the two experienced head doctor and the resident doctor, and she was getting the CAT scan, and her vital signs were unstable, and her blood pressure kept dropping, so they knew she was bleeding from somewhere, and they kept saying, it's going to be the spleen, it's going to be the spleen. The spleen is a relatively friable organ internally and is very commonly damaged in accidents of this sort, and they kept saying, it's going to be the spleen, it's going to be the spleen. And I remember her body images slowly showing up on the CAT scan, and at that point it was almost an emergency to get her to the operating room because her blood pressure was so low, and you saw just the top edge of her abdomen and the blood, which identified the spleen, but they were going to take her to the operating room anyway. So at that point we pulled her out of the CAT scanner, we went right to the operating room. I assisted in her operation, and she did have a lacerated spleen that was bleeding that had to be removed. Luckily, that's possible with the spleen, and she had other injuries which had to be attended to, and then other more severe injuries. And then, like all patients going through that, she survived. She did well, but she was sent to the surgical ICU unit to heal and recover. She was then our patient that we followed and took care of. The following day was September 11th, 2001, and probably the day or two after, later that week, I was alerted to come talk about this woman that had been in a car accident on Monday. And what I learned at that time is that woman was the head police officer for the training division of the Port Authority Police Department, who was stationed at the World Trade Center. She certainly would have been at work on Tuesday, September 11th, 2001. So the car accident that almost killed her actually saved her life. Most unfortunately, we had to talk because she was still not conscious at that point. I believe over 30 Port Authority police officers died that day, and she had trained many of them. Many of them, I was told, had just graduated from the program that she oversaw, and she knew them very well, these young men and women. And we worked over the next week, and her family worked to bring in pictures of all of them, and then we discussed how to break the news to her, which obviously was going to be beyond devastating for someone who would have been there that day, dedicated their life to that. And of course, I will never forget that.
Wow. Okay, thank you for your time. It was great having you here.